Hey everyone, it's Paul with New Jersey Recovery and Wellness, and welcome to National Recovery Month. All month long, we're going to be talking about different ways to support a person you know and love who has a substance use disorder or is in recovery. So here's part one of our 30-day series. Number one, talk about it. There's lots of different reasons to have upfront and forward direct conversations with your loved ones about concerns of their substance use disorder or about what's going on in their recovery program. First and foremost, it's going to help them combat denial. If a person is still actively using substances, being able to approach them with some concerns or with some observations lets them know that they're being seen. Possibly helps them break through the thoughts that they have it under control, that no one is suspecting what's going on. And for people who are in recovery, having these conversations can be very, very validating. Asking inquisitively, looking to inquire to know what's going on in their lives, how they're doing. Number two, it lets them know that you care. By being able to step outside of our comfort zone and be able to talk about real things that are going on in our loved ones' lives, it shows genuine care and has the ability for us to express some empathy with where they're at. This can go a very, very long distance for individuals who are making or considering to make very significant changes in their lives. It also creates inroads to have meaningful conversations about a variety of different topics. When you're doing this, it's going to be very, very important to be non-judgmental. We don't want to push people away. We want to keep the door open for communication. We want to express love, concern, and empathy. We're really coming at this at a place of trying to connect with this individual who we care about. We want to make sure that we keep these doors open when we're having these conversations, so it's viewed as a safe place where they can keep on coming back to when we check in from time to time. We also want to ask open-ended questions. So some differences between open and closed-ended questions. Closed-ended questions are those that are going to result in either a yes or no answer or a very brief answer, whereas open-ended questions are going to invite the person to talk a little bit more, lets them know that we want to hear their thoughts and their perspectives. So here's some examples of the differences between closed and open-ended questions. So for a closed-ended question, do you think you have a problem? It's a pretty brief answer, right? A comparison there is, what would be a sign that things are going too far? It invites them to think and talk about it a little bit more. Whereas for a person who's in recovery, do you ever think about relapsing? It's a closed-ended question. Whereas if you ask, what have you experienced as supportive of your recovery? Not only is it a positively tuned question, but it also invites further conversation. Last, we want to make sure that we listen. No matter what's being said, we want to hear out our loved one. We want to hear their experience, hopefully their experience, strength, and hope, and invite continued conversation moving forward. Thanks for checking out our video for day one of National Recovery Month. If you liked what you saw, please give a thumbs up to the video, click that like and subscribe, and check us out next time.